why do we care? Why is this a problem? Why does the Physician Advocacy Institute exist? Why are there people who are worried about a lack of independent physician services? Because in some ways you think, well, is it better having 10,000 independent pharmacies, or is it okay having 7 competitive large multinational or at least national pharmacies? Maybe that's just as good. Maybe it's better off. There's some efficiencies with scale. You can have less executives. You get bulk discounts and things like that. Well, what we found through this process in the healthcare system, and not surprising to anyone who's actually gotten care or had to pay for the care, is that the more consolidation we have, the less pressure there is to keep costs low. And so costs tend to go up when you have less competition. I mean, I guess it's kind of obvious, but the efficiencies that are gained are rarely ones that are transferred or carried over to the consumer, whether that's the employer paying for the bills or whether it's the patient. And so essentially you have people paying more for healthcare and not getting better care. They're just paying more for it. And so the more you have consolidation, the more you have these large healthcare systems growing together or adding hospitals or adding physicians practices, it just becomes, there's less pressure on a healthcare system to keep costs low for obvious reasons, because they capture more of the market. And so if you have more of the market share, you have less concern about, your competitor.